Hi, this is Rich Vernadeau. Welcome to the Rich Vernadeau News Network. And on today's edition of the news, we look at the coronavirus spread and the media, news, and internet response to it from across the web. Here's a few sound bites from several different news media about the severity and the spread of the coronavirus.
And now the ambassador to China was on one of the Sunday shows this weekend, and he did not deny that coronavirus could have started in a weapons lab. Do we know if this started in a research lab, and how come they won't allow the CDC in there to better understand how this started? Because if they started this in a weapons lab, that's evidence that they are developing or trying to develop weapons of mass destruction, biological weapons.
San Diego County is now under a public health emergency because of the coronavirus. 2 patients are being treated at UCSD Medical Center.
And 10 News reporter Natay Holmes joins us live this morning from the County Health and Human Services Department. Natay, health officials say this emergency declaration is going to help San Diego get ahead of the disease.
Well, while the emergency declaration has many paying close attention to the coronavirus cases here in San Diego, county health officials are urging that this does not mean that there is a heightened risk to the public.
It is really a proactive step of prevention and protection, and to position ourselves accordingly with additional resources.
Now, after making the announcement about the public health emergency, county officials emphasized the need for extra funds and supplies. Now, the resources needed include mutual aid, reimbursement, and ensuring that the county doctors have all the medical supplies they need. Now, there are currently 2 people that tested positive for coronavirus. Both are recovering at UCSD Medical Center, and the patients were aboard the 2 flights that arrived in Miramar last week. Now, there are roughly 230 people that remain quarantined on base, and the quarantine is expected to end next week.
That we're seeing with this disease, because its death rate is relatively low and it's higher than flu. It's nothing to shake a stick at, but it's not Armageddon. The fact that so much draconian action is being taken, despite the fact that it's obvious that quarantines alone aren't going to do anything anyway, disinfecting alone isn't helping in China, it seems. It begs the question, are the governments of the world hedging their bets on this being an escape by a weapon? Because it is possible that that's the case. We don't have evidence of it. We have only speculation. We have only speculation and the coincidence that it happens to have been near this one particularly nasty bioweapons facility. And that strikes people as mysterious. The initial reaction of the Chinese government was to censor people. It seems like the tech firms right now are sort of circling wagons with the CDC and other groups to try to fight misinformation on coronavirus. It's like, why? You know, this was never done for SARS. This was never done for MERS. This wasn't done for the West African Ebola outbreak. This is the only time that you've ever had a situation like this. Are you assuming that this is going to get worse? I think it probably will, but is the CDC just going to come out and assume that? The WHO refusing to reevaluate the situation at all? Refusing to say yes or no, this will become a pandemic? I mean, it already basically is. You're getting up towards tomorrow, it could hit 70,000 cases, or at least will be reasonably close. You got another nation now with a case. I mean, it probably doesn't take hold, but what if it does? What if it takes hold in Cairo? The metropolitan region of Cairo has, 20 million people or some crazy number in it? Crammed into a relatively small area in which half that population really don't have access to a normal medical apparatus? That could be bad. That'd be like if it breaks out in Bangladesh, which I'm surprised, honestly, that it hasn't already. Or in an urban setting in India. India, to its credit, India and Kerala managed to it appears, contain the possibility of this epidemic. Of course, with a 24-day potential incubation period, we're not 100% sure. We got to wait another couple of weeks before we declare that India doesn't have an active infection out there that we just haven't accounted for. That's the other part. It could take up to 3 or 4 weeks before you actually know about everyone who might have been infected by an individual. At least now they're looking at the imaging of the lungs in order to sort of double diagnose a person instead of just saying, well, they don't have direct symptoms of it even if they're testing positive. We're not going to count it as a suspected case because we're just fucking stupid. And you do have to be stupid. Then we learn the test kits, of course, aren't nearly 100% accurate. In fact, they fail. What's the failure rate? 10%? 15%? I'd like to see like a full-on study about this. But yeah, people should probably be reasonably ready. Again, not panic, because panic will kill more people potentially than a disease will. But basic preparation to prevent panic, to prevent congestion, to prevent all sorts of problems. Knowing about the disease, education is important. This is not a doomsday disease, but it could kill you. Wash your hands frequently. Washing your hands frequently is probably more important than wearing an N95 mask. The latter probably doesn't even do anything. This might be at least partially an airborne virus. That mask does jack fucking shit, dude. Someone sneezes on you. It doesn't matter that the nose and the mouth are covered. It's on your skin. It's in your eyes. Maybe you can get infected that way. This can be transferred through human sweat. So